Welcome to Webinar Wednesday. Today's webinar is eligible for 1 CE credit from the ACI. At the conclusion of this episode, you will be able to access a link that will take you to a quick survey. Once the survey is completed, then you'll be able to download your certificate directly from your device. Before we begin today's webinar, I'd like to invite you to save the date for our upcoming webinar week. This event is July 27th through July 30th online and will include a live webinar daily with additional on-demand webinars released throughout the week. Visit webinarwednesday.live for more details. Today's webinar features Al Gresh, VP of Healthcare Strategy for Accruent, and Mike Zimmer, Senior Solutions Engineer for Accruent. Their webinar is titled Developing and Sustaining an AEM Program and Connectiv. They will be discussing the history, benefits, and how to implement an AEM program.
Hello and welcome everyone to today's TechNation On-Demand webinar from sponsor Accruent. Today's session will focus on developing and sustaining an AEM program and is eligible for 1 CEU credit from the ACI. And now I would like to introduce today's speakers, Al Gresh and Mike Zimmer. Al is Vice President of Healthcare Strategy at Accruent Healthcare and has held executive leadership roles at AlphaSource, TriMedx, and Alexian Brothers Health System. He also led one of the nation's premier clinical engineering programs at Aurora Health Care in Milwaukee and has held the chair role at AAMI's Healthcare Technology Leadership Committee. He also authored the 2019 Healthcare Technology Management Manual for AAMI. Mike Zimmer. Mike is the Senior Solutions Engineer over the Connectiv product. His role includes taking our clients through the various solutions that Accruent offers, as well as communicating market needs to products and engineering teams. And with that, I'm happy to turn it over to Al.
Thank you, Kelly, and thanks also to TechNation for providing this forum. AEM, or Alternative Equipment Maintenance, has been around for a while, and in fact, many in the industry developed their own programs using both risk and failure rate analyses to stop doing things that weren't bringing value so that they could dedicate resources to other activities that did bring value. Yet, I'm surprised at the number of people who still don't have an AEM program in place. And in fact, Joint Commission and DNV surveyors are even asking, well, why not? And several I've asked about it state they simply don't have confidence in their data to support and defend any decisions on AEM. So hopefully you've taken the opportunity to listen to the 10 Steps series available on Accruent's website under the resources link, particularly the ones dedicated to data integrity. Okay, let's get started. Joining me today will be Mike Zimmer. I'll be going through most of the presentation, but Mike will support me by going through real-life demonstration of how to do some of the things I'm going to talk about in a modern CMMS. Today we'll be doing a review of the history of AEM. We'll be reviewing requirements of an AEM program, discussing benefits of an AEM program, review how to implement an AEM program, discuss various methods for making your program defensible, and then share results of an implemented plan. And like I said, Mike will be doing a demonstration of built-in tools using a modern CMMS platform. So again, let's start with a review of the history of AEM. On December 2nd, 2011, CMS released the Hospital Equipment Maintenance Requirements Interpretive Guidelines, stating that hospitals should follow manufacturer's plan maintenance requirements. And after a lot of freaking out by a lot of people and gathering of a lot of different organizations to lobby back to CMS, they then in December of 2013 released revisions to Hospital Equipment Maintenance Requirements Interpretive Guidelines, which included a section on AEM. In March of 2014, CMS and Joint Commission revised standards to dictate a certain group of devices that must follow manufacturer's recommendations, including equipment subject to federal law, state law, or CMMS conditions of participation, imaging of radiologic equipment, medical device lasers, new medical equipment where you don't have sufficient history to determine whether AEM is appropriate, although we will talk a little bit about some alternative resources for that. And then equipment that's not in an AEM program must follow manufacturer's recommendations. Then in October of 2015, AAMI announced the support of the Maintenance Practices Task Force, which was led by Malcolm Ridgway. Later on in the presentation, I'll share a link to some of the work that group's been doing. So let's review the requirements of an AEM program. In July of 2018, the Joint Commission standards, particularly EC 020401, says the hospital manages medical equipment risks. I checked the most recent standards and nothing of what I'm sharing today has changed, so all of this is still relevant. Element of Performance 4 states that hospital identifies activities and associated frequencies in writing for maintaining, inspecting, and testing all medical equipment on the inventory. These activities and associated frequencies are in accordance with the manufacturer's recommendations or with strategies of an AEM program. And then in the notes on EP4 says that the strategies of an AEM program must not reduce the safety of equipment, must be based on accepted standards of practice, such as ANSI, AAMI, EQ 56, 2013, which, by the way, are in the process of being revised. Those are the recommended practice for medical equipment management program. Note 2 states medical equipment with activities and associated frequencies in accordance with manufacturer's recommendations must have a 100% completion rate. And also, those both high risk and non-high risk in an AEM must also have a 100% completion rate. And hopefully everyone's figured out by now that applies only to available equipment, but of course you have to have a plan in place to address those items that you weren't able to get your hands on. Element of Performance 5, they talk about the carve-outs for things that you can't put on an AEM program. So as I stated, equipment subject to federal or state law or Medicare conditions of participation, in which inspecting, testing, and maintaining must be in accordance with manufacturer recommendations or otherwise establishes more stringent maintenance requirements. And I do want to call that part out, that it seems to be lost on a lot of people that AEM is in fact a two-way street. And I'll talk about how in my past I applied that concept to add things to the PM that would reduce failure rates, and I'll talk about the outcomes of that as well. Medical lasers are one of the carve-outs as well. Imaging and radiologic equipment, new imaging equipment with insufficient maintenance history to support changes or variations from OEM procedures and frequencies, and then maintenance history includes any of the following documented evidence: records provided by the hospital's contractors, information made public by nationally recognized sources, and records of the hospital's experience over time. And that second bullet, we'll talk about the DataInsights platform and how that could help you support your program. And Mike will be covering that later on in the session here. EP6 indicates that a qualified individual uses written criteria to support the determination whether it's safe to permit medical equipment to be maintained in an alternate manner. And hopefully, given the fact that you're in the position you're in, you're deemed qualified. So you take into account how the equipment's used, prevalence of harm during normal use, consequences of equipment failure or malfunction, including seriousness or prevalence of harm, and we'll go through some of that methodology. The other components of EP6, availability of alternative or backup equipment, incident history of identical or similar equipment, and maintenance requirements of the equipment. EP7 states that the hospital identifies medical equipment on its inventory that's included in an AEM program. So if you think about this, it really comes down to three main items that a surveyor will be looking for. The first is what criteria did you use to make the determination that you could put something on an AEM program, and was that person qualified, and did you use accepted standards to do that? The second thing is to identify what's stated here. Identify the equipment on your inventory that's on an AEM program. And then the third is to do some follow-up monitoring to make sure that the decisions that you made to put something on an AEM program, in fact, did not have a negative impact on the safety or performance of that device. And again, Mike will show later on in the session how to very easily do that in a modern CMMS. So let's talk about the benefits of an AEM program. The thing that CMS is looking at is increased safety. And talked about this in the opening comments that when you talk about increased safety, if you stop doing things that aren't bringing value and you focus that time and energy and resources on things that do bring value, overall that increases the safety of your entire equipment base and your program. And a side benefit, obviously, is decreased man hours. I want to make sure that everybody understands here. When I say decreased man hours, I don't mean reduction in staff. What it does mean is that you apply those resources elsewhere. I often heard from my own staff over the years when we were trying to implement programs and initiatives to increase productivity and efficiency, there's certain individuals that would say, oh, I know why you're doing this, because you're going to try to get rid of me. And kind of shook my head. It's like, do you have any idea how many opportunities are in front of us that we simply don't have the bandwidth to tackle? And that's what this does, is it frees up hours for us to go after those other things that will bring greater value to our organization and increase the visibility and the value of our department. And then obviously with that, you're decreasing costs. And I've always said, and it's often been stated, that quality actually costs less. So there are various methods of determining appropriate maintenance. One that I'm sure many have heard of is the Reliability-Centered Maintenance, or RCM. Again, that was the program or the group that was initiated by Malcolm Ridgway, sanctioned by AAMI. And there's a link here for that site, and you can click on that or copy and paste that to your browser and go see what that group has been up to. There's a lot of information there showing what their methodologies are and the information that's been collected from different sources and aggregated to help with some of the decisions. There's the evidence-based maintenance, or EBM, that was published and talked about by Bin-Sing Wang. He actually applied this methodology in an organization that he worked in. It incorporates the same principles as evidence-based medicine. It's data-driven design based on standardized failure cause codes, and I'll go through that in a little bit more detail a little later on. And then some of the others are survival analysis. That's one of the things that you can get information from in our DataInsights platform. Some of the RCM factors and considerations, PM procedure type. So is it a device restoration, or is it simply a safety verification? Also looking at level of severity categories, and I would have to believe that everyone has some version of this in their risk assessment already. Is it a level of severity 0, which is negligible impact, all the way up to a level of severity 3, which is serious life-threatening injury? And then lastly, PM-related reliability. And most often people look at mean time between failure for that. Within the DataInsight platform, we actually developed an algorithm that provides a reliability index. And Mike will be demonstrating that later on. Here is the evidence-based maintenance failure cause codes that Binsing developed. You can see the abbreviation for the failure cause code and a description of that code, and then whether it's used for corrective maintenance, planned maintenance, or both. And I won't read through all of this. You can go through this in detail at your leisure. One other thing I want to call out is last year at AAMI, a group of us got together and developed the CMMS vendor collaborative. And it was something that AAMI has taken the responsibility to oversee, and they engaged both Matt Baratich and Carol Davis-Smith to facilitate this effort. And what it is all of the major CMMS vendors getting together and coming up with a recommended list of codes. And we started with the failure codes precisely because we felt that this is something that if people adopted, they could certainly use this to support and sustain their AEM program. And so this is the list of failure codes that this group came up with, along with definitions and examples. If you're going to incorporate this, these are the key components. Beyond just having a code, you have to have a clear definition of what that code is used for. Examples help your staff understand how to use those codes so that you get to the point where everybody's doing the same thing. And once you have that, then you can readily see how equipment is failing, when is it failing, and is it something that I can actually prevent if I were to do planned maintenance. So those are the kind of things that certainly help determine whether or not something should go on an AEM program. And there was actually a webinar that they put on June 9th. If you didn't get a chance to watch that, I'm sure if you go to the AAMI website, you should be able to access that and watch it. So now let's talk about how to implement an AEM program. And then I outlined some clear steps here to follow that should make that relatively easy. The first is to assess risk, considering your failure modes, looking at device reliability, process-related failures, and maintenance-related failures. And again, that's much easier if you incorporate some of those failure codes, whether you're using the evidence-based maintenance or the CMMS collaborative list of codes. Back in my early days, if you've been in the industry long enough, you'll readily recognize the Fenneco-Smith model of looking at risk. It was a good model to create a risk-based maintenance program, but what it didn't include was probability. Steve Grimes, I think, was the first time that I had seen this, that he and others developed this and presented. And this is a risk scoring matrix that I think everyone has adopted. It looks at both probability and severity. This is something that Matt Baratich has talked about in his traveling roadshow over the past year and a half on how to develop an AEM program, and recommends that you incorporate this type of a risk scoring methodology. When you look at the combination of severity and probability, literally anything that's in that green category should be eligible for an AEM program. The ones that are in yellow, I think you can still incorporate those into an AEM program with some guardrails, but then the items that are in red, you shouldn't consider putting anything rated in those categories on an AEM program. The second step is to assess for inclusion in the AEM program. You start out with the CMS carve-out. That's easy, right? Those are things that have been dictated. You can't put on an AEM program, so you can immediately filter those things out. And from there, then look at risk criteria and use professional experience and supporting data to help make those decisions. And the thing I want to call out in all of this is CMS and subsequently DNV and TJC are never prescriptive about how you do this. So I'll show you the methodology that I use to do some of this. You're open to come up with your own as well. And as I said, Mike will demonstrate some of the assessment tools that exist in Connectiv to do this very easily. This is just a review of the reliability-centered maintenance factors and considerations. I won't read through this again, but that's another methodology. From there, you can then assess appropriate frequency and depth of PM based on standardized methodology. Whatever methodology you choose, make sure that it's something that you can convey to a surveyor about how you came to that. What the methodology that I use, and again, this is back long before anyone had even coined the term AEM, was in addition to the risk factors, we incorporated a failure rate methodology. Essentially what it was we developed an algorithm where we came up with a monthly failure rate for each device category, where that failure rate was determined by taking the number of corrective maintenance work orders for that device type over the inventory of equipment in that device category, multiplied by the time frame in years that we were tracking that, or the historical data was collected, and then divided all of that by 12 to come up with a monthly failure rate. And once we determined what that failure rate was, then based on the fact that most of the equipment that we had in our inventory, as we looked at it, averaged one failure per device per year. And so we used that as our starting, plugging those numbers into that formula, came up with a starting baseline of 8.33% failure rate. And so with that, if the monthly failure rate was above 8.33%, then we would evaluate for an increase in PM frequency and or PM depth. So, adding steps to the PM to try and reduce that failure rate. You have to understand that AEM is a two-way street. Yes, you can reduce the frequency or extend the PM interval if you're not going to reduce the risk at all. But on the flip side, if you are experiencing a higher failure rate, what are you doing to try and reduce that failure rate? And I'll share some of the results of what we did that. So then if the monthly failure rate was below 8.33%, then we evaluated for a decrease in PM frequency or depth, or removal from the PM program altogether and put it on a run to fail. We took a very cautious and measured approach with that, and so we stated that PM frequencies may only be decreased at a maximum of 1 year increments unless approved by HTM leadership. Also, the maximum PM frequency for any device is 2 years. Any device category that is rated greater than 2 years will be removed from the PM program and labeled as run to fail. With this, we took a very cautious approach. So, for instance, if something was on a 6-month PM interval, then we would just move to the next step, which was annual. If it was annual, then we would move to every 2 years. But I also know of many people who, after their initial assessment, immediately went from a scheduled PM to run to fail. And as long as you have the data to support that and good rationale, there's no reason why you couldn't do that. And then lastly, once a PM frequency has been determined, it will be documented in the planned maintenance assessment table and entered into the CMMS. And I'll show you what that table looked like. But as I said, Mike's going to show you how to do this very, very easily in Connectiv toward the end of this session. Step number 4, ensure a complete set of PM procedures. If you attended the webinar that Mike and I just completed on standardization of your processes, policies, and procedures, we covered that pretty well. And that information or that recording is available on our website. with setting up a complete set of PM procedures, again, look at first the CMMS carve-outs. Okay, so if it dictates that manufacturer recommended procedures need to be followed, then that's what you use, right? That's easy. If no PM is required, that's also easy. There's no PM procedure required. But if a PM is required and you're not required to use manufacturer recommended procedures, then you start with that as a baseline and then determine, are there any steps that are unnecessary or any additional steps that are needed in order to reduce your failure rates. And this was covered in that webinar recording, but this was a policy that we had in place for planned maintenance procedure creation and implementation to talk about how those procedures were created and the time frame in which they needed to be developed if a new procedure was required. Again, I won't go through this in detail, but you can certainly walk through this at your leisure. And if anybody wants to get a copy of this, I'm happy to share it. And then lastly, continuously monitor impact and outcomes of program changes to ensure no reduction in patient safety or an increase in failure rates. And again, Mike will show how that's very easily done within Connectiv. Okay, so now let's discuss the methods for making your AEM program defensible. I talked earlier about putting information using that algorithm failure rate, putting that information into a planned maintenance assessment table. And here's a small sampling of that, where you can see for each device category, we collected the baseline inventory for that equipment, the 36-month baseline work order count, the 36-month history and corrective hours, total corrective hours in a year, baseline failure rate, what the prior year's failure rate was, what the current failure rate is, and then what that failure rate change was, last review date, regulatory mandated frequency, what the current number of PMs per year are. You'll see that a lot of these are blank. But regardless, this is the information that we did collect, and if a surveyor wanted to see that we were monitoring whether or not the decisions we made were good decisions, this is what we used. Now, as I said several times, Mike will be going through how to do that very, very easily within Connectiv without having to track things in a spreadsheet. So let's quickly look at the results of an implemented plan. The first pass at implementing our failure rate analysis to adjust PM intervals garnered an additional 3,000 hours of technician time per year. That is huge. Depending on what your annual device hours per technician are, and the industry average is about 1,000. So that's 3 technicians. That was huge. I acknowledge that it was a larger organization. This is the kind of thing that will free up time for you to focus on more important things. And again, this is all done without reducing the safety of our program or the equipment in our organization at all. Going back to this being a two-way street, where you look at ways to decrease the failure rates. We engaged our technicians in being part of this process and analyzing how things were failing, making recommendations on things that we could add to the PM in order to reduce those failure rates. And the first year that we implemented that process, by increasing our PM time by 135 hours, we were able to reduce our CM time by over 1,500 hours. I would say that's a pretty good investment. One of the things that CMS is looking for, that you do acknowledge that it's a two-way street, and not only are you looking to stop doing the things that you don't need to do, but do more of the things that you should do to make your equipment safer and more reliable. And then I just want to go back to this EP4 where they talked about ways that you should evaluate the stuff that goes on your AEM program and the criteria that you use. And they do acknowledge that you can use information or data from other sources. And so DataInsights is one fantastic source for that, and provides a reliability index, life expectancy of equipment types, and down to the specific model level, along with the survival analysis. Top failure mechanisms, so how are these things failing? Also the purchase price and total maintenance costs. So these are the kind of things that help you if you've got holes in your database, for being able to calculate cost to service ratio, which you can't do without the purchase price, and looking at total maintenance costs to see how you compare to that, but also to help you do effective resource planning if you do have new equipment added to your inventory that you haven't previously had in your inventory. So at this point, I'm ready to turn it over to Mike Zimmer to do a live demonstration of the built-in tools using a modern CMMS platform. So Mike?
Right, awesome. Thank you so much, Al. So as Al had mentioned several times over the course of his part of the presentation, I'm going to illustrate how somebody could use a modern CMMS solution like Connectiv to accomplish the following with respect to alternate equipment management, or AEM. So we're going to be focusing on, how do you capture the various pieces of information, the criteria to test for AEM qualification within your asset inventory. How does a modern CMMS solution assist in the identification of pieces of equipment that happen to be on an AEM program? And then finally, how do you perform that ongoing monitoring that Al had mentioned during his conversation within your CMMS solution? So let's jump over into our CMMS Connectiv to show how this is accomplished. Determining what assets qualify to be put onto an AEM is, as you might imagine, one of the most crucial things you can do with respect to implementing an AEM program, successfully, right? So the way that we solve for that in Connectiv is by scoring the asset. So within our solution, I'll go ahead and pull this up here. You have the ability of grouping together different subsets of your asset inventory in order to be assessed. All right, so on screen we have an example of such a grouping. As you can see, it's taking a look at all of our anesthesia units that we currently have within our inventory here. Now, why would you want to differ from just a broad assessment of just a category of equipment? So the AEM qualification status is going to differ based on things like utilization of that piece of equipment. So you can group these assets within a solution like Connectiv based on their location, because their utilization rate is going to impact whether or not they should be put onto an AEM. So that's what we've got built out into this portion of the solution. Now on screen, you're also going to notice that we've got this section on this form called AEM scoring. And for this group of assets, it's got an AEM score of 18. And that's going to correlate to an AEM level of allowed. Now within Connectiv, you have the ability of setting up these thresholds. Now what this threshold accomplishes within the tool is it tells it anything between two values. In the case of this instance that we have displayed on screen here, any score between 0 and 30 is going to be allowed. Anything that scores 31 and above are not going to be allowed to be put onto an AEM. So that's where the score resides, and it's identifying this particular grouping of anesthesia units as being allowed to be put onto an AEM. So let's now take a look at what criteria we're using in order to come up with this score within this application. So if we navigate down to Take Risk/AEM Assessment, it's going to pull up the survey that the individual that's testing this group of assets is going to navigate and interact with in order to determine whether or not it qualifies. So on screen, we see a listing of questions, and this came about from work that we did with one of our customers that had hired some Joint Commission consultants to assist in the putting together of this questionnaire. Now, if your organization currently manages this kind of assessment, this scoring methodology external to your CMMS solution, modern CMMS solutions like Connectiv should be able to take that kind of questionnaire type data and import it into the tool so that everything resides underneath the umbrella that is your CMMS/enterprise asset management solution. So each one of these questions, as you can see, has a response, and those responses have a numerical score associated to them. And that is where Connectiv is tabulating the score that we saw on the previous screen. So as the person or group of people that's in charge of assessing this group of assets, I'm going to come through here and answer each one of these questions honestly, because I am the person that is best suited or best informed, or best qualified to answer this set of questions. Now, I did want to bring up one thing here, and it's under the AEM exclusion question. You can see that if I break open this question a little bit more for some more information, it's going to kind of mention some of the carve-outs that we talked about earlier, or that Al had mentioned previously. So things like whether or not this is an imaging or radiologic device or a medical laser device. Now, we all know that devices that are of that nature cannot be put onto an AEM. They have to adhere to the OEM schedule. If I had answered in the affirmative for this question, you can see that it's got a numerical score of 50. Now, thinking back to what we just discussed around how the score is thresholded within the Connectiv application, you know that anything 31 and above is going to be disqualified from being included into an AEM program. This is the case here, because I would, of course, answer with that score of 50 if this was a medical laser device that we were assessing. It's not in this case. We're talking about anesthesia units, so I continue down these various lists of questions here, and I click Submit. Now, Connectiv, in this case, is going to go through my survey responses and calculate the score for us. That's where the score of 18 comes from, and that's how we know that this grouping of assets qualifies for AEM. Now, we haven't done anything to the actual maintenance schedules on these assets. That's actually the next step in the process and what we'll cover now. When that alteration to the maintenance schedule on the assets that fall under the AEM needs to take place, that's actually going to take place or occur on a different part of the Connectiv application. And now that is going to happen on something called the maintenance plan change. Now, the maintenance plan change is, as you might imagine, where you indicate what the changes to the maintenance of those assets under the AEM is going to occur. That's why it's called what it is called. So if we were to pull up an example of one of those, we're going to see what kind of information is going to be captured or input by the person that's suggesting the change from OEM to AEM. So when this is originally submitted for approval, and we're going to get to what happens when that submission for approval occurs, but the individual is going to capture some pretty key pieces of information. Now, this is going to include the effective date, the termination date of the change to the maintenance plan on the asset, when it should be next reviewed, and who that review should be assigned to when that review comes up. Of course, within Connectiv, you have the ability of creating notifications, reports, dashboards, etc., so that whomever's assigned to the review of these maintenance plan changes should be well aware of the fact that they're going to have to perform the review with however much lead time that they may need, so 30, 60, 90 days, etc. They're going to indicate the short description of the maintenance plan change. In this case, it's an AEM for some microscopes that we have in our inventory. Most importantly, in my opinion, maybe the most interesting aspect of the maintenance plan change are these AEM KPIs. Now, these are vital things to select when you're wanting to do that ongoing monitoring that Al brought up previously. This is going to allow us to do that comparative analysis and help us determine whether the AEM is having a negative impact on the maintenance of the asset. So if we were to walk down the list, you'll see some really key performance indicators or KPIs around exactly that. What is this asset doing now that it's under an AEM? So things like the percentage of corrective maintenance work orders, mean time between failures, etc. So a vital part of suggesting the change from OEM to AEM is how we're going to perform that ongoing monitoring of it. Equally as important is the baseline and comparison range of dates that we see on screen. Now, what this is going to tell Connectiv is Okay, so in this point of time, as this AEM's in effect, I want you to compare it against what the assets were doing for the previous 2 to 3 years, right? Now this is going to be pulling historical maintenance information for these assets from within the CMMS itself. And as Al had mentioned, it's also acceptable to take external sources of information into account as well. And we're going to get to that towards the end of my portion of our webinar today. So I input that information. I include what the OEM recommends that we do in terms of a maintenance schedule on this asset, what we're recommending. So this is where we get into the justification around why we're going to move it over into an AEM, things along those lines. And then once that information is all input into this aspect of the solution, I'm going to click Submit for approval. Now, approval workflows are a key component to the Connectiv application and other modern CMMS solutions. And what that does, without any additional human involvement, it sends a request for approval to either a pre-established individual or group of people so they can review the various aspects of this maintenance plan change and either reject it or approve it. Assuming that they approve it, what then occurs is that there's a nightly automation that occurs within the Connectiv application that looks out across these maintenance plan changes, finds which ones are coming into effect, and then automatically selects the under an AEM checkbox on the asset record. So that answers for how do we identify which aspects or which parts of our asset inventory, are included under an AEM. It does it for you automatically. There's actually not human interaction or human involvement needed in order to indicate that as such on the asset record. And then reporting against a checkbox field of that nature within the Connectiv application and other modern tools is very straightforward. All right, so we've gone from, how do we test for qualification via very objective criteria? How do we document and justify the move from AEM to OEM? How do we indicate or identify which assets are under an AEM? Now let's talk about the last piece of the puzzle, so to speak. How do we perform that ongoing monitoring of the AEM's performance? That's also going to take place on this maintenance plan change. So if we were to scroll down to the bottom of this record and click on the AEM Performance tab, this is where we're going to see that real-time monitoring of what's going on with the assets under this AEM. So we can see all the KPIs that we had selected previously when we were first suggesting the move from OEM to AEM. And we can see the assets' performance against them. So if we looked at this particular example, so failures per year per device over the last 3 years, you can see that we've got a warning threshold percentage of 5% and a breach threshold percentage of 10. In this case, we're noticing a 20% increase or 20% change against this particular key performance indicator. And that's automatically flagged the review level as review required. Now, a modern CMMS should be delivering you information rather than forcing you to navigate into this level of depth within the application. And Connectiv is a good example of that. Because again, you can build up a series of notifications that's going to alert whomever needs to know that review is required this particular KPI for this AEM that we've got in place within our application. Okay, that concludes the CMMS-based or CMMS-focused portion of AEM program management within your organization. So we went through how do you test against objectively measured criteria, how does Connectiv and other modern CMMS solutions help you identify what assets are under AEM, and then finally we just saw an example of how it can assist you in the ongoing monitoring of the AEM's performance within your organization against the assets in your inventory. Finally, what I want to talk to everybody about today is using those external sources. So previously in our webinar today, Al had mentioned that it is possible to use external sources of data to help inform your AEM decisions. So let's take a look at how Accruent and the DataInsights team has put together a tool that assists our customers in doing exactly that. On screen, I've got the newest product that's been added to the healthcare portfolio here at Accruent called DataInsights. So what our DataInsights team has done is approach quite a few of our largest healthcare customers at Accruent, asking for them to share their data with us with respect to assets, work orders, parts and labor, etc. Now, over the course of up to a year, I believe, they've taken that information, cleaned it, standardized it, and it's resulted in this highly reliable set of information around the models that make up the asset inventories of our healthcare customers. So there's some really great information being displayed here, and it kind of warrants its own demonstration, but that's not quite the purpose of today's webinar. If I were to go to reliability, these are those key attributes that you're needing out of an external data source to help you in your justification of moving something from an OEM to AEM. So things like its long-term dependability or reliability are indicated on screen here. Now this is coming up with this score by taking a look at its mean time between failures and an average amount of labor hours spent per year on this device. M2BF is called out as its own metric along the right-hand side here. And then we can also see what common PM schedules are present in this very large set of information that we're basing these insights off of. And then finally, we can see what the correlation between preventative maintenance schedules and corrective maintenance or failures on those devices. So you can also help, or rather use that information as directional evidence to move this from an OEM to an AEM. Then there's also a pre-built report within the My Institutions tab of the DataInsights product, specifically for AEM opportunities. Now this is going to compare your existing inventory of models within your organization against what information is being presented within DataInsights to help determine which models are the richest target or the lowest hanging fruit from a AEM perspective. That concludes my portion of the webinar. I'll hand things back to Kelly so she can wrap it up for us. Kelly?
Thanks, Mike. We are now coming to the end of today's webinar session. If you have any questions you would like us to answer, please contact sales@accruent.com and we will answer them just as soon as we can. Several times through today's session, I'll reference the 10 steps to make your HTM and HFM departments a strategic asset webinar series, which is approved for 1 ACI credit per session and is available on demand at the Accruent website. Go to accruent.com/healthcare under resources and select webinars. You will see the entire series there. The post-webinar certification is automated through Technation and will also be included in the follow-up email coming to your inbox shortly. And with that, we will conclude today's webinar. Thank you very much for attending, and thank you, Al and Mike, for sharing your expertise. Look for the follow-up emails coming to your inbox shortly. Thank you, stay safe, and have a great rest of your day.
Thank you, Al and Mike. This concludes the Accruent On Demand webinar. If you enjoyed today's episode, you might enjoy our ongoing webinar series, Webinar Wednesday. You can find a calendar of upcoming live webinars as well as an archive of on-demand webinars at webinarwednesday.live. To obtain your certificate for 1 CE credit from the ACI, please remember to click the link located below this webinar title to complete today's survey. If you have any questions, you can reach us at webinars@mdpublishing.com.